Hi there and welcome. Today I'm doing a video which I am calling An Introduction to Family Systems and Empathy Through Parts Work. This will be good for if you're a therapist in training, a mental health student, or anybody who's interested in better understanding the human mind. In this lecture, we're going to explore a model of therapy that is grounded in compassion, curiosity, and deep emotional connection. Called Internal Family Systems, or IFS. And here's what we're going to cover: what IFS is and how it views the mind as a system of parts, the role of the self as a healing force, how parts shape emotional reactivity and behavior. Then we'll talk about the characteristics of self, characterized by 8C words, and how to spot parts in everyday client language. Finally, we'll talk about how to use David Burns' 5 Secrets of Effective Communication to facilitate internal dialogue. Let's get started. IFS was developed by Dr. Richard Schwartz in the 1980s. So what's the core idea? And this is very different from other psychological systems. And that's the human mind is the system made up of parts. Some call it metaphors or moods, but they're not. They are actual sub-personalities. Each has feelings, thoughts, roles, and fears. Think of it. Have you ever heard someone say, "A part of me wants to leave, but another part is scared to do so," or "I feel like a little kid when I talk to my boss"? That's real. And in IFS, those are parts speaking up. So what parts do we work with? We're going to talk about 3 major types of parts. The first part is called managers, and these are parts that try to control situations. They may look like anxiety, overthinking, perfectionism, people pleasing. Basically, they are parts of us trying to keep things stable, to avoid bumps in life. However, sometimes there's another part called firefighters. These parts react. When emotions rise, they use distraction, avoidance, even self-destructive behaviors like overeating or drinking or shutting down or getting enraged. But those parts themselves, they are not bad. They're just trying to stop the pain. Then there's the third type, the exiles. And these are parts of us that carry wounds, pain, usually very young and vulnerable, often overwhelmed. They hold strong feelings like shame, grief, loneliness, helplessness. When triggered, the whole system panics. Managers and firefighters do whatever they can to keep those exiles quiet. Now let's take a closer look at how these parts interact. As IFS isn't just about naming isolated emotions. It's about seeing how our internal system responds as a team, and sometimes as a team in conflict. Imagine for a moment when a client says, "I was up all night scrolling and then I beat myself up all morning." Through the IFS perspective, you might hear a firefighter part that numbed through scrolling, a manager part that punished with criticism, and underneath both of them, an exile part carrying pain or emptiness. It's important to remember these parts are not dysfunctional. They're trying to help. They're reacting to something vulnerable inside. We don't fix parts. We get to know them. We respect their history. And this is where deep empathy begins. Not just how do you feel, but what part is feeling this and why? Therapists who work from this lens can help clients soften their internal wars and lead themselves with more grace. So let's keep going. Now, here's the powerful part. In the IFS model, everyone, everyone, has something called the self. The self is a part of you that's calm, compassionate, and clear. It's not a role, not a coping mechanism. It's who you are at your core. I didn't like myself when I got angry, which means I am something in there that doesn't like it. That's the I of the self. The goal of therapy in IFS is to help the self lead. And when the self is in charge, it can approach your parts, those parts trying to control everything else, with the 8 C's of self energy. What are those 8 C's? It's calm, curiosity, it is clarity, it is compassion, it is confidence, it is courage, it is creativity, and it has connectedness. They're already inside of you. They're your core. They are yourself. Our job in therapy and life is to make space for those qualities. So how do you know when a client, or anybody for that matter, is speaking from the self? It's subtle, but it's there. For instance, a client might say, I hate that part of me that overeats. They're likely blended with that critical part. In other words, they're likely feeling that critical part is who they are. They're not talking from self. But when they say, I'm curious about why that part feels so desperate, that's for sure they're in the self. From the inside, when we feel in self, we feel calm and confident in all the 8 C's that we just mentioned. Therapy often begins with us as the external self, offering calm, connected presence that the client doesn't feel internally. Over time, we help the client build that capacity for themselves. We let go of our guidance. We don't want to be loaning ourself to the clients. The amazing thing is, of course, that self-energy is always accessible. It can't be damaged. It can only be obscured. It can be hidden. It can be covered up with other layers. And even when someone is completely blended with parts, you can ask one simple question. How do you feel about that part right now? If the answer is annoyed or ashamed, they're in a part. If it's curious or compassionate, even slightly open, they're in self. And your role as a therapist is to notice, mirror it back, and to help them stay there. Let's look at how those parts show up in a session. So for a moment, imagine a client saying, I don't know what happened. 1 minute I was fine, and then I blew up. I was so ashamed I couldn't look at my partner. With an IFS lens, we might hear a fire part exploded, and a shame exile was triggered. And maybe a manager part saying, you should have kept it together. This is blending. When a part takes over, the person feels like they are the part. I got angry. I got enraged. When it's really the firefighter part that got enraged. So when a part takes over, it feels like they are the part. And our job as therapists is to help unblend. To help them say, a part of me was angry instead of I was angry. That small shift opens the door to empathy. Let's go a little bit deeper into this idea of emotional reactivity or reactiveness. Every extreme reaction in therapy or in life can be traced back to a part in pain. Sometimes it's loud, like anger or panic or shutdown. Other times it's quiet, avoidance, numbness, or over-intellectualizing. These are often protectors, stepping in before the clients get too close to an exile. So when you hear a client say, or anybody that you're trying to have a serious conversation with especially, so if that person's going to say to you, I just don't want to talk about it. The therapist, rather than pushing in, try stepping back. Use curiosity. You might say, that sounds like a protector. What do you think it's trying to stop you from feeling? Use your curiosity and compassion. That one question changes the whole atmosphere, changes the room. Because now you're no longer analyzing behavior, but you're building trust with that part of the person. This trust is what makes IFS so respectful. No shaming, no bypassing, just an invitation to look inside and to speak with each part with dignity. As a therapist, the essential job is to listen for the parts in how the clients are speaking. So we're going to watch out for phrases like, I know I shouldn't feel this way, or there's a part of me that just shuts down, or maybe I feel so torn, or a possibility of, I just hate myself when I'm like that. These types of words, these types of phraseologies indicate that multiple parts are interacting and sometimes fighting. So instead of jumping in with advice, which is not really a good idea on most ways of therapy, but also not even to reframe them as would be common in some of the more modern ways of therapy, slow down and try asking something like, can we get curious about that part? That part that hates yourself? Or what do you want to know? Or what does it want to know? You want to engender curiosity, or teach the client to ask, what is that part afraid of? You won't be pathologizing. You're building a relationship with that part, with compassion at the center. Let's take a look at how to help clients get to know a part, which is really where we have a important task. But interestingly, you don't need any fancy interventions. The most important thing is you slow down. So let's say, for instance, a client says, I always sabotage myself before I succeed. I'm just completely into self-sabotage. So what would be a type of response that would go along with this? You might say something like, can we stay with that part for a moment? That one that sabotages? What does it feel like? Where do you sense it in your body? What does that part want to know? So often you just being curious shifts the system. So a client might say, it's scared. It doesn't trust that success will last. That's the opening. In that moment, the door to healing is cracked open. Not because you fixed it, because you made room for that part to be heard. So what's the intervention here? Slowing down and listening. Listening is the intervention. Asking a client to listen to themselves. And that's where empathy deepens. I have to include one more technique, which is, in essence, the opposite of slowing down and listening. Because clients often do not know how to be curious on how to listen to their parts and how to access self, their own self, and bring it to the fore. So I have to introduce a technique which is called in IFS direct access, which means direct access to the self. So this is where the therapist speaks directly to the client's part rather than having the client speak for or to it. So you might say something like, to the part that's feeling right now, I just want to thank you. You've been trying to protect this person for a long time. You probably show up when things are out of control, and you're welcome here. You're talking directly to that part. And this is different from interpretation or confrontation or even reframing. It's a respectful communication to that part itself. So when we use direct access, what we're doing is we're actually modeling what it's like to speak from self. In other words, you're using your self and lending it to the client. You speak in a calm, clear, compassionate, and connected voice. And clients will often absorb this tone. Over time, they begin to mirror it in how they talk to themselves. Eventually, when you feel that it's ready, then you can try to go a little bit further. You might ask something like, would you like try saying something to the part the way I just did? And when they're able to do that, something shifts. They start relating to that part in a more kind, compassionate, connected, and creative manner. And the part that felt rejected and misunderstood or feared starts to trust the client again. That's the real magic of IFS. Now let's talk about how we can support this inner dialogue with effective communication using David Burns' 5 Secrets of Effective Communication. These tools are usually used between people, but in IFS we can use them to facilitate communication within the client's system. I want to walk through each one. The first is disarming. Disarming is finding truth in what the other person is saying, even if it is painful and even if it is something absurd. So when the client says, I'm a failure, and you recognize this as a part of him, rather than saying, well, you're a failure and it's true, or you're not a failure, or you feel like a failure because you actually want to be better, you help explore by disarming. It sounds like a part of you is trying to protect you by being tough. Or let's find the truth that part is holding, even if the message feels pretty harsh. This will help the client or the client's self disarm the inner critic, that manager or firefighter, as it will, without silencing it. Secret number 2 has to do with empathy. There's thought empathy and feeling empathy. Thought empathy is paraphrasing what the other person said, and feeling empathy is guessing what is actually feeling. Especially when you're using what's called direct access, you are modeling the type of curiosity the self should have, because the client still has to learn. So you might paraphrase what that part is saying. But you might say, this part believes you'll never be good enough. And that would be thought empathy. You should also use feeling empathy. So that's very exhausting. It's very tiring to carry such that. And then you could ask the client, how do you feel about this part right now? If the client says, I hate it, they're blended. You still have to work on getting to understand what's behind and driving that part. Be curious about the part. If the answer is, I'm curious, they're using their self. And it's the empathy that unlocks that shift. The third secret is inquiry, right? Inquiry is trying to facilitate from the other person more of what he or she is feeling from this situation. This gives the ability to go deeper and more intimate in the relationship. In IFS, you're curious and you're still asking questions, but not challenging. But the idea is to understand, in genuine level to understand. So you would be asking, what is this part afraid of? How old does it feel? How long has it been doing this job, saving you from this exile, this bundle of uncomfortable emotions? And when you do the inquiry, it gets a deeper relationship between people and even between parts. Now, the fourth secret is I feel statements, which is harder to put into IFS. It allows the client to avoid denial. The self actually might be saying, I feel compassion for this part that's been carrying so much. If authentic, it keeps the client connected to their self. The fifth secret is stroking or affirmation, which basically means to express appreciation even when things are hard and difficult. This, of course, avoids conflict in interpersonal relationships, but it also elevates the manager or firefighter to a more amenable station. it sounds like this part has been working nonstop for years. And that's real dedication. Even the method isn't working anymore, but there's still a lot of strength in that. Or you might say it's remarkable how much this part wants to save you from that uncomfortable exile. When we validate the part's intention, it softens, just like people do when you validate their intents. Most clients come into therapy thinking something's wrong with me. I need something fixed. But in IFS, we say have a completely different take on this. In IFS, we say there's a reason why every part exists, and let's get to know them and what their intentions are and what each part is doing in order to help you. So that part which originally you feel disdain for and want to get rid of, etc., which whenever you attack anything, the natural reaction is to counterattack, and that's true with the parts of ourselves also. But when you want to get to know them and you're honestly curious, this opens the door to self-empathy. Self-empathy is the foundation for real change. Clients who used to hate their anxiety begin to say, this anxious part is trying to help me. It's trying to keep me safe. It's trying to do something else. But it just wants me to feel better. And I want to understand its intentions, its ways of working, and where it comes from. And you wind up with compassion, a calm compassion for the part of you which previously you wanted to get rid of and kill off inside of you. And that's transformation, real healing. Okay, so let me just recap what I've covered up until now. Internal family systems teaches us that the mind is made of parts. And every part that we have inside us is trying to protect us. There are different types of parts. There's the manager, there is the firefighter, and there's the exile. Those are three basic types of parts. Behind that is the self, which is a healing center. It's calm, curious, compassionate. And that's who we are in our core. And this is natural state of being. As therapists, we help clients access that self-energy so they can build relationships with their parts. What we've brought into this talk is that we can use the 5 secrets of effective communication to help them with respect, empathy, and courage. Thank you very much for watching, and I hope to see you in the next video.